Good afternoon, everyone. Myself, Madhu Kushwaha, Assistant Professor in SIRT Pharmacy, Bhopal. The subject name is Pharmacology Second. The code is VP503T. Unit Third. The topic name is Prostaglandins. Prostaglandins first discovered in prostate gland, and this is the different type of prostaglandins from arachidonic acid. The synthesis of prostaglandins and leukotrienes, also called as eicosanoids. Prostaglandins and leukotrienes are biologically active derivatives of 20 carbon atom polysaturated essential fatty acids that are released from cell membrane phospholipids. The Greek eikosa means 20 carbons. Principal eicosanoids are prostaglandins Pg, prostacyclins Pgi2, thromboxanes Tx, and leukotrienes is Lt. Prostaglandins, any of a group of physically active substances having diverse hormone-like effects in animals. Prostaglandins were discovered in human semen in 1935 by the Swedish physiologist Ulf von Euler, who named them. They were secreted by the prostate gland. The understanding of prostaglandins grew in the 1960s and the 70s with the pioneering research of Swedish biochemist Sune K. Bergström and the Benjit Ingemar Samuelson and British biochemist Sir John Robert When the threesome shared the Nobel Prize for Physiology or Medicine in 1982 for their isolation, identification, and analysis of numerous prostaglandins. And this is the chemical structure of postanoic acid. Then this is the different type of prostaglandins. First one is prostaglandin A2, second one is prostaglandin E1, and third one is prostaglandin F2 alpha. Then types of prostaglandins and their receptors and the function performed by the prostaglandins. PGI2 receptor is the GS. The function of the PGI2 receptor is vasodilation, inhibit platelet aggregation, bronchodilation, and second type of prostaglandin is PGD2. The receptors binds with GPCR produced by mast cell, eosinophils, and basophils. Second, critical to development of allergic diseases such as asthma. And third one is PGE2 and the receptor name is GS and GI. The function of the PGE2 is bronchoconstriction, GI tract smooth muscle contraction, bronchodilation, GI tract is smooth muscle relaxation, and vasodilation when PGE2 bind with GI and decrease gastric acid secretion, increase gastric mucus secretion. Third one is uterus contraction when pregnant, and fourth and last one is lipolysis inhibition, and last one is prostaglandin is PGF2 alpha is binds with GQ receptor, and the function performed by prostaglandin F2 alpha is uterus contraction, bronchoconstriction, urinary bladder constrictions. These all are the receptors and their action through the prostaglandins. Synthesis of prostaglandins. First, prostaglandins is formed by phospholipid and the phospholipase A2 converts in arachidonic acid, and this arachidonic acid is in the presence of peroxidase is converted in prostaglandin H2, and this prostaglandin H2 is further converted in PGD2 in the presence of PGD synthase, and prostaglandin H2 further convert in PGE2 in the presence of PGE synthase and further convert in PGF2, and the prostacyclin synthase is the prostacyclin. PGI2 is the synthesis of the prostaglandin and subtype of prostaglandins, and this is the chemical structure of the prostaglandin synthesis through the membrane phospholipid in the presence of phospholipase A, which is activated by the chemical or mechanical stimuli which which act on the phospholipids, and then arachidonic acid form, and this arachidonic acid is its metabolite is PGG2. Arachidonic is further converted in the presence of cyclooxygenase and lipoxygenase. In cyclooxygenase is converted in PGG2, and PGG2 is further converted in PGH2, and this PGH2 is further isomers thromboxane and prostacyclin further, and these are the subdivision of the prostaglandin, thromboxanes and prostacyclins. Physiological effects. Regulation of blood pressure. The prostaglandins are vasodilator in function. Second, this result in increased blood flow and decreased peripheral resistance to lower the blood pressure. Third one is the prostaglandins serve as agent in the treatment of hypertension. In inflammation, it also induces the symptom of inflammation due to arteriolar dilation, vasodilation. Prostaglandins are natural mediators of inflammatory reactions of the rheumatoid arthritis, cirrhosis, and conjunctivitis. Corticosteroids are used to treat these inflammatory reactions since they inhibit prostaglandin synthesis. And third point is that in reproduction, the action of the prostaglandin in reproduction, it is also used for the medical termination of pregnancy and induction of labor. Then in pain and fever, pyrogen promotes prostaglandin synthesis leading to the formation of PGE2 in hypothalamus, regulation of body temperature, histamine and the bradykinin cause pain. Third one is the aspirin and other non-steroidal drug inhibit prostaglandin synthesis and thus control fever and relieve pain. In regulation of gastric secretion, the role of prostaglandins. Prostaglandins inhibits gastric secretion. Prostaglandins are used for the treatment of gastric ulcer. Prostaglandins stimulate pancreatic secretion and increase the mortality of intestine, which often causes diarrhea. On effects on metabolism, prostaglandins influence certain metabolic reactions through the mediation of the CAMP. PGE decreases lipolysis, increases glycogen formation and promote calcium mobilization. In platelet aggregation and thrombosis, thromboxane and the prostaglandin promote platelet aggregation and blood clotting that might lead to thrombosis. Prostacyclin inhibits the platelet aggregation. And this is effect on the influence on immune system, influence on renal functions. PGE increases glomerular filtration rate and promote urine output. Second one is the excretion of sodium and potassium is also increases the PGE. And this is the drug preparations are used for the inhibition of the pain and inflammation by using these drugs: dinoprostone, dinoprost, carboprost, jameprost, Alprostadil or misoprostol, inoprostil, epoprostenol, latanoprostol, and eloprostol. And the preparations are different type of preparations are available in the market through vaginal, IM, IV, and topical and IV infusion all are also available in the form of in the form of liquid and suppositories, and uses is induction labor, midterm abortion, and midterm abortion control of PPH, and also latanoprostol is used in the form of topical used in glaucoma, and iloprost used in IM uses in decrease infect size when given IM after MI. Applications of eicosanoids. Pharmacological applications of eicosanoids. Cardiovascular uses pulmonary arterial hypertension, peripheral vascular diseases for keeping the ductus arteriosus open until surgery in neonate carrying certain cardiac malformations and platelet anti-aggregation agent. And second is indigestive uses indicated in the treatment of the gastroduodenal ulcer and for the prevention of acid induced ulcer. Gynecological and the obstetrical uses, they induce cer- cervical cervical dilation and the uterine contraction, particularly in late pregnancy, used for medical termination of pregnancy and induction of labor. Thank you.